Good morning, everyone. Hope you had a great weekend. So today's video is about ice or cryotherapy. It's a risk management video. So of course this one will have some questions at the end and will be in the continuing education portion of the software. So let's get right into it. Risk management training, ICE. And we're going to talk about ICE and its application, but more from a risk management standpoint. If you understand how it's applied and what the physiological mechanisms are doing, then you'll understand what the risks are a little bit better. So we're going to talk a little bit about those things. So indications first. First of all, of course, within recent injury, within 72 hours, and you have to understand that within 72 hours of an injury, there are a lot of processes going on, a lot of inflammatory processes, and those processes take up space within the tissues. They actually cause the tissues to swell. And when the tissues swell, you stimulate what's called nociceptors within the tissues, and then that creates pain. So the more swelling you have, the more pain you have. And also, the chemicals that are being attracted to the area due to the injury to the tissue, there are leukotrienes and prostaglandins and things of that nature, they're also nociceptively sensitive, which is a fancy way to say that they cause pain to the tissues as well. So ice can keep that process from coming on as much, and so with recent injury, it's definitely an indication. Swelling, so again, same reason. If a tissue is swollen, then ice is an indicator, or is indicated to reduce that swelling. It is indicated in when you have pain, and that is because the pain can be numbed through the ice, and we'll talk a little bit about that later. And this can be chronic pain as well as acute pain. So, again, ice is a little bit different than heat because you can use ice in the beginning of an injury and even with chronic pain, whereas in heat, you definitely don't want to be using heat within that first 72 hours. So that's the main difference between ice and heat is ice can be used with chronic pain or acute pain, and heat is only with chronic pain, and they work differently because there's different mechanisms of action going on. So that's an important note to make about ice compared to heat in terms of its indications. So what is the mechanism of action? Well, first of all, ice is a vasoconstrictor. So you remember that heat was a vasodilator. So it increases the diameter, if you will, of the blood vessels, whereas ice actually shrinks them. And imagine, if you're really cold, which again, we were in New York last weekend and it was super cold, and my extremities just got really cold as well because the blood vessels vasoconstricted, and your body is trying to conserve heat and whatnot, so it pulls the blood into the core. So just remember that ice is a vasoconstrictor and reduces the diameter of blood vessels. It also decreases blood circulation by a mechanism called viscosity. So again, if it's a really cold morning, you got to turn your car over, and you turn it over, and the oil is all real thick because it's so cold. That's increased viscosity, and ice does that. So it basically makes the fluid thicker, if you will. It doesn't flow quite as well. It also decreases nerve conduction velocity, and this is evident when you use ice properly and it numbs the skin. You're basically decreasing that nerve conduction velocity. You can put your foot in a bucket of ice for a period of time and you'll get it out, and your foot won't work quite as well. You won't be able to scrunch your toes and whatnot, and that's because the nerves aren't firing properly. And it decreases cellular metabolism as well. So, in other words, the cells are the little factories in and of themselves, and they're constantly sort of making energy and getting rid of waste products and whatnot. But you can lower that. You can take like a sliding scale and just lower that activity by decreasing the temperature of the cell. A very important two quick examples of this, if you can just kind of understand how this works. First of all, there are many examples of folks that have fallen through the ice and into very cold water, say up north and during the wintertime and whatnot, and they have literally been under for as long as 45 minutes. They're obviously they're dead, if you will, for all intents and purposes. But there's many examples where they'll bring them up and they evacuate the water out of their lungs, and then they actually can revive them because their cellular metabolism, the cells, and and potentially there could be, some would say a miracle, and I'm not arguing that as well, but kind of come back. But certainly from a physiological standpoint, the cells are decreased, or in a decreased metabolic state, and they don't begin to break down like we would if we were deprived of oxygen at a normal temperature. And then they bring them up slowly, then these people are actually revived, and it's quite amazing. Another example of how decreased cellular metabolism can involve a better outcome. I saw this story on the Today Show probably about a year or two ago now, but there are studies and trials in effect right now where they're taking people who have spinal cord injuries, and they're actually immediately treating the spinal cord injury. And this is not a severed spinal cord, this is more of a bruised spinal cord. But you have to understand, when the spinal cord is bruised, the central nervous system, the repair process actually damages the conductivity, or the conductiveness of the nerves. So they actually, as the bruise repairs, it scars down the spinal cord, and it actually causes the spinal cord not to work anymore. So the vast majority of people who have they're totally paralyzed, they don't sever the spinal cord, they actually bruise the spinal cord to the degree that the healing process causes it not to work anymore. And some people who have been paralyzed actually have some functionality. They just don't have obviously what they need to be able to have in order to walk again, and or use their arms, whatever level of paralysis that they have. But if you can decrease the damage during the healing process of the spinal cord, then you can kind of subvert the permanent damage that happens when you damage your spinal cord. And so this story on the Today Show showed a gymnast, and he was kind of doing a flip, and he landed on his head, and you saw his head, and it was actually on video. They caught it on video. So someone was videoing this competition or whatever, and he landed on his head at a very unnatural angle, and he was instantly paralyzed. He could not feel his legs, his arms, anything. And he was close enough to one of these centers where they were doing the study, and so they took him in. They cooled down his whole body temperature. They packed his neck in ice. I mean, they really pulled everything down, and he was almost in a medically induced coma for a period of time. And basically, to make a long story short, at the end of the story, it was like 4 days later, he was walking out of the hospital. So they actually videoed him. They interviewed him as well on the Today Show. And it was a really, great outcome. Now, without the ice therapy, the big question is, would he have been able to walk out and not have any permanent effects whatsoever? Possibly, maybe not. I mean, certainly, I think that, this ice protocol that they put him through, I would want the ice protocol if I had to damage spinal cord. There's no doubt about that. But it underscores how there's this decreased cellular metabolism is how it can affect a recovery, if you will. So using ice is one of the most powerful things that we can use on someone who has certainly a new injury, to decrease swelling and decrease the damage that happens from the natural healing process. And hopefully you'll kind of remember that by those stories. Contraindications. First, we have Raynaud's phenomenon. Raynaud's is a small vessel disease, and it's sometimes symptomatic and sometimes not. But if you put ice on, it can kind of induce symptoms. So you should be careful in that situation. Any other cold hypersensitivity, you don't want to use ice with anyone else who's just hypersensitive to cold. And any areas where it's already numb. So if you use ice on an area that already has numbness, kind of like heat, there's no way to gauge if the tissue is being damaged. So you have to be very careful with that. Diabetics are a good, example of this. You don't want to use ice on someone who has a really, diabetically affected lower limb. You wouldn't put a very diabetic foot, maybe that has a lot of blood vessel damage already, in, an ice bath or a foot bath of ice, and you wouldn't put ice on top of that either. So if the skin looks abnormal, then you definitely want to be asking whether or not we should put ice on this. And there are some definite absolute contraindications as well. Now, precautions would be people with cardiac problems such as arrhythmias, anginas, or congestive heart disease. And the reason for this is it's kind of a shock to the system, and you wouldn't want to overload the heart. So you got to definitely be exercise caution with these people. People with high blood pressure, so if you vasoconstrict or if you cause the blood vessels to shrink, you're going to increase the blood pressure even more. So you want to be, have exercise precaution with those people. And then over superficial nerves, so you want to be careful with putting ice directly on superficial nerves. You know, like the funny bone would be an example. That doesn't mean you can't do it. You just want to be sensitive to that potentially because these nerves are closer to the surface, and that's the ulnar nerve, by the way, the funny bone nerve. Most people know it as the funny bone. And then over healing wounds, you want to be, exercise precaution here as well. We do this a lot in a post-surgical situation, post-surgical rehabilitation. We certainly put ice over, healing wounds, but, again, you want to look at the wound before you're putting ice on it. You want to make sure that it's something that, shouldn't have ice on it. If the wound was, if it was oozing or it was pussy or it didn't look right for whatever reason or maybe super red, you want to bring that to the doctor's attention and make sure that it's appropriate to put ice on that particular area. And then ice application, we have, be sure you put a thin covering over the skin. That's very important. You don't want to burn the skin. Gel packs or a flexible alternative is better than, say, a hard ice pack. No doubt about that. You can also use half, like alcohol plus water. You can mix alcohol and water like half and half, or you can play with the ratio there a little bit. And when you put it in the freezer, it won't ever freeze to a hard, like a block of ice. So it stays flexible because the alcohol freezes at a lower temperature. And then you can just kind of mix some water to kind of adjust how flexible it is. That's a great alternative to an actual, gel pack. 20 minutes max. You don't want to go longer than that. You can damage the skin, of course, if you go longer than that. And it should be numb after 8 minutes. So if you have a thick towel or something over the skin, then it won't go numb after 8 minutes, and you're not really, applying the ice properly. And then it can be used with compression for added benefit. So if you have it on an ankle or something like that, you can wrap an ace bandage around the ice, and the added compression actually helps the ice even work better because if you're using it for swelling, it's compressing. So we call it RICE, rest, ice, compression, and elevation. Those are the components of RICE, which is something you do after an injury. And then the risk of ice, tissue damage due to excessive cold, that is a definite risk. And if you take the precautions that we have just kind of outlined, putting a thin something between the ice and the skin, and then making sure that you don't do it for longer than 20 minutes, you're going to minimize this tissue damage risk. And then, of course, again, any risk are greatly reduced if you applied for less than 20 minutes. So, when you go longer than 20 minutes, you begin to kind of bring a lot more risk of tissue damage into the mix, and you want to be careful with that. So that is it for ice risk management. Go to the continuing education and answer the test questions, and it just shows that you have gone through this video and this training about the ice therapy or risk management associated with it. So take care. Talk to you next week.